for the Mpox special briefing from Africa CDC. My name is Margaret Edwin, the Director of Communications. I will be moderating the session. Today, we are joined by our main speaker, Dr. Jean Kassia, the Director General of Africa CDC, and we are also joined by the Director of NPHI from DRC, Dr. Dieudonné Mwamba. I will now hand it over to the DG to start the session. Over to you, DG.
Good morning, good afternoon, good evening, all of you. We are taking this call today from Addis Ababa. Yesterday and the day before, I was in Nigeria to assess the performance of the program and to also support the wonderful job done by my brother, Professor Pate, the Minister of Nigeria, and to celebrate the success on the TB agenda. Today, we'll start our press conference with what the world is calling the disease X. First slide, please. You can put it first. Okay. Today, as we know, we have this disease in DRC, particularly in Panzi district, where, second slide, please, where we have around 527, second slide, 527 cases already recorded. And out of the 527 cases, we have almost 42% or 43% under 5 children. And in terms of deaths, we are talking about the 32 deaths coming from health facility level, but we have a number of deaths, around 44. We are saying around because there is ongoing investigation. We want to understand what is going on in DRC. But what is important, I wanted to flag here. If you compare from last week to this week, we have additional 147 cases. If you compare the previous week to last week, it was 111 cases. It means it's a major public health issue in DRC. And I think the Director General of the National Public Health Institute of DRC will provide more information about it. Next slide. Today, DRC and Africa CDC didn't communicate about any pathogen regarding this disease. I want to make it clear. DRC and Africa CDC didn't communicate about any pathogen. The person who's leading all investigation at INRB, it means the National Institute of Biomedical Research in DRC. This is the main referral institute for research and lab. Professor Placide Mbala sent me the message that I'm posting to all of you with his permission. That message was clearly saying that the first samples that they received on the 7th of December, they were poor quality samples. The whole blood and serum were poorly preserved, and some show hemolysis. With that, there was no way for them to conduct the testing and to give us the main reason of this pathogen. And even he said, we don't think that we can obtain any relevant information with that. And a team went back to Panzi, a multidisciplinary team coming from the ministry, from Africa CDC, and from WHO to investigate what's happening in Panzi. But I give you, for those who don't know Panzi, when we talk about 700 kilometers, we talk about this road. It takes 3 days to drive from Kinshasa to Panzi. Then we hope by beginning of next week, we'll have the team bringing back some of the samples they are collecting, and we'll communicate. For now, today, we are not giving any indication, any official indication regarding this disease. Next slide, please. Let me talk about Mpox now. We still have this ongoing disease outbreak with 2 countries that moved from controlled stage to active transmission, that are Ghana and Congo. This kind of yo-yo, we see it every week. Countries moving from active transmission to controlled stage, but sometimes coming back. As we are saying every day, we need to reinforce our surveillance. We need to make sure that the lab system is in place everywhere. In terms of statistics, only the week 48, we recorded 3,545 new cases. This one is one of the highest number of cases we have since we started, because our average was between 2,500 to 3,000. But now we have 3,500. It means this outbreak is still moving. And in total, we have 65,000 cases, 65,711. Yes, we are still losing people. I was meeting in DRC last week, a mother who came to meet me talking about his son, 27-year-old, who passed on due to Mpox. He was the only son of this mother. I think when you are facing this kind of challenges, you know that this outbreak is real. Next slide. Currently, the transmission is mostly driven by Clade 1B and Clade 1A. And you'll see the combination of Clade 1A and 1B is in DRC, in the middle. But you'll see on your left, Clade 1A, that is not too major, but the Clade 1B, in addition to DRC, you have Burundi, Rwanda, where we have more cases. Clade 2 in Africa today is not the prominent one. We don't have so many cases. Even the last week that we had Clade 2, it was a week of the 44. Now, our focus is mostly on Clade 1B and 1A. Next slide. And this Clade 1B, we are reinforcing the cross-border surveillance, because you'll see in number of countries affected, it was mostly due to a movement of people. And we are, as Africa CDC and WHO and all partners, supporting countries. What we are doing, it's unfortunately without the testing capacity, because we don't have rapid tests for Mpox. The surveillance, cross-border surveillance or entry point will be appropriate if we had rapid tests, because we cannot do the PCR at this level. What we are doing mostly is to sensitize people, to screen them in terms of temperature, asking if they have some symptoms, but this is the only thing we can do. We hope with the research ongoing, we can have one day the rapid test for Mpox. Next slide. When we talk about the cross-border surveillance, this is an example. Angola affected by DRC, and they notify 9 cases. Now we got the vaccination plan from Angola. I will make sure that next week they will get vaccines to start to vaccinate because Angola is ready today. Next slide. I wanted to discuss with you this issue of testing. Many times when colleagues are asking about, next slide, please. This one will come. Next slide. Yes, many times when we are talking about testing, we don't understand why DRC is standing around 20%. But you see, the testing was moving based on the number of cases. When around week 13, 15, 17, we have low cases. They were testing all of these cases. But now you have more cases. The capacity to test is not appropriate one. This is why Africa CDC is supporting DRC now to activate 463 gen experts, in addition to 7 qPCR machines that we are providing to all to decentralize the lab testing in DRC. Next slide. We have ongoing vaccination in some countries like DRC, Nigeria, and Rwanda. Currently, we are celebrating this success in Rwanda, in DRC, and we are also waiting to see what will be the aggregated result from Nigeria. But things are moving well, and we are glad to see that African countries and African communities are accepting the vaccine. Next slide, please. Talking about vaccines, talking about medicines, talking about diagnostics, we are talking about research. Currently, we have 48 projects ongoing. We are targeting vaccine, we are targeting diagnostics, we are targeting therapeutics, but we are targeting also social behavior. And this is the first time to see all of the studies ongoing at the same time, and Africa CDC is playing a leading role for that. As an example, I will talk, next slide, I will talk about the ongoing study regarding the smallpox vaccine versus the control to confirm, to prevent confirmed cases. And this is one of the studies that our team is conducting in DRC and in Uganda. And we believe that the first semester of 2025, we can get the outcome of the study that will help us to talk about the post-exposure prophylaxis regarding Mpox disease. The next slide is about the vaccine for children between 2 to 12. As you know, Bavarian Nordic, when we started to use that, it was for 17 to 17 plus. then 12 plus. Then we got approval to use for 7 plus. Now we have this study ongoing to see if we can confirm that based on the approval from SAGE for 2 plus. It means from 2 years to 12 and plus. This study is important for us to convince our communities that this vaccine is safe and